Our next speaker is Dr. Gil Altarovitz, who comes to us from Harvard Medical School, where he's a faculty member and director of the Biomedical Cybernetics Laboratory. He is a core faculty member of the Children's Hospital Informatics Program and also affiliated with the Department of Electrical Engineering and Computer Science at the Massachusetts Institute of Technology, which means you just have way too much time on your hands, Gil, apparently. His work on integrative methods for big data in the biomedical informatics space has been published or presented in more than 30 peer-reviewed publications, ranging from academic journals and international conferences to 3 books, including Systems Bioinformatics and Engineering Case-Based Approach, which was ranked #1 in the new Amazon Bioinformatics category. Today he'll be talking to us about the substitutable medical applications, reusable technologies, that's SMART, and how medical information and genomics can be integrated into apps that can better inform patients and physicians. So, Gil, thank you very much for coming.
Thank you, Grant, for that kind introduction, and thank you, everyone, for coming. All right. So let's get started, and this is really our This is really our central problem that we'll be addressing today. There's been, people say that there's an app for that. There's an app for just about everything. And people have actually cited that there are a number of kind of patient-centered medical apps out there. And there are. But how many actually use real patient data? How many integrate real genetic information about the patient? How many integrate information from devices that are from the patient? Not many, I would say. And so what our goal was to create a standard so that people could create such apps, and then also, as in doing so, to make a few demonstration apps that do that. So hopefully there would be an app for that. I'm going to actually start by a little bit of introduction. As Grant mentioned, I'm a faculty over in Boston, and so some of my research has actually been about putting together and looking at complex traits. So some of the most complicated ones are ones that also involve behavior. So they obviously have an environmental component. And so you might ask yourself, will you become an alcoholic? Assuming you're exposed to some alcohol at some point. That's how this kind of study would be conducted. And can you look at genetic information, genetic sequence, clinical information, family history, and other factors, and how well could you predict something like this that might seem to be hard to do? So, I'm not going to go in through the overall methods, but just to say that this was kind of a motivating case example of why we wanted to be able to do this. Because if you're able to develop models like this, then the end user, the person who wants to be asking the question, might be a patient. And one of the best ways to deliver information to them and a physician or a caregiver would be through an app. So this approach uses a network approach because it's a complex trait. So rather than looking at one gene at a time, like a number of different genetic tests that people have been talking about do, whether it be on breast cancer and a few other ones, this one integrates many pieces of information, whether it be some of the clinical information here or the gene or pathway-based information. And what we found actually was that it's very important to integrate these pieces of information. So it's important because if you look at only clinical and demographic information, including some of the family history, you don't get as good of a predictor. If you only look at genetics, then you're going to get a better predictor. But if you integrate all the pieces of information, you're going to have a much better predictor. And while some people may think that it's the beer that is addicted to them, we actually know otherwise. So I think one of the keys here is that there's a really big link between phenomics and genomics, right? There's a link between what we can find in the clinical record and what we can find in the genomics of the patient. And so kind of establishing that link and connecting those pieces of information, that's kind of what this project is about. So I liken it to kind of like how you might things were with phones. So how many of you remember, well, I mean, I guess there's still a few of these around, the flip phones, right? That, the infamous clamshell shape, right? So, maybe we have a few in the garage, and, it was nice for some things, like making a phone call, but it wasn't very good for other things that we actually use phones for a lot more today, right? We didn't use them for the internet, we didn't use them for calendar and calculators. And why is that? Because they were vendor-specific apps. The vendors weren't trying to get you to use the apps. They were trying to sell you a phone service, so that you'd make a phone call. And it was very good at that. But what we really needed, what we've discovered that we need are these apps that talk to other places. The calendar that synchronizes with your calendar at work. The calculator that may include more than, just addition and subtraction. And there was also no incentive by the vendors at that point to make what we call these sort of long tail apps. That is, these apps that are not used by many people, or they're used not very frequently, but they could be used a lot by the people who actually use them. And for example, like a family history app. Not many people are going to use it, but some of the people will really have a lot of use for that. And so that kind of thing, all of these things really changed with once we got smartphones, whether it be Android or the iOS. What we see are independent apps. We see a developer and user community that's engaged. And we see long tail apps that are available. So I think one of the critical problems now is that we have apps. I mean, we do have apps. It's just that they don't really connect with the data, and they don't connect really with the AHRs. The problem is the plug doesn't really fit. After this conference, I'm actually off to China, and I have a very special converter that works between all the different countries, because in China there's a different one than in Hong Kong, which is part of China, and then Taiwan's going to have a different one. And then Japan's got a different one. So everyone's got a different plug, and so if you have an adapter, you can talk to all the different languages and use the same computer for it. In this case, we want to develop apps that talk to EHRs, that talk to the genomics cloud companies that are arising, as well as talk to other data that the patient may enter. I showed it kind of in a cartoon way, but this is kind of what we have here. Like, these containers would be sources of data, and what happens is people may write an app for one, but it can't really talk to another. And so what we basically need to do is kind of have this converter in between that will allow things to work better. And people have tried many things in the past, some of which are not as smart to do as others. This one was actually a product that turned out to be an April Fool's Day joke, but you could get it into your you have to get it into your cart before you found that out. But to understand what we really want to do, we have to look at the challenges, and some of them are that currently there's really no simple standard API that is like an application programming interface to access clinical and especially genomic data. And there's really, especially in genomic data, which is kind of my emphasis in this talk and within the SMART project, some of the contents are really the same. You've got sequences that are, there's a standard way of representing that kind of conceptually. There's certain genetic file formats that are standard. But sometimes the data are structured differently. And there's also different methods that people use to authenticate to get the data from different companies that have the data. And so what we've been trying to do is work together with a number of the companies, a number of the standard organizations, to be able to create a kind of a simple design of an API so that it's geared toward developers and users. Kind of, again, thinking of kind of like the iPhone model where if developers get really engaged and users get engaged, then they can drive forward the types of applications that we'll need in the future. So essentially it'll be like a sandbox where you can test out different concepts, and those that survive and are used a lot end up being perhaps adopted in clinical care. So the way we saw it is that there were really these three crystallizing events. One, I believe Josh mentioned earlier and was referred to before, the eMERGE network. And that was instrumental in linking together electronic medical records and genomic information within its first cycle as a sort of a research kind of effort. And then there's the SMART platform, which was basically funded by the Office of the National Coordinator, about a $50 million or so project to create a standard that would be used and that could be used to access clinical information in a standard way that could sit on top of standards such as HL7 and others, as well as and make it easier for developers to create independent apps. And the third thing is the idea of consolidated clinical document architecture, CCDA, and the Meaningful Use 2.0, which is kind of incentivizing people to try and adopt some of the standards for how to represent this information. We've seen the map of the eMERGE network, so I'll skip that. So what is SMART? It was discussed a little bit before, but the goal is really to accelerate medical application innovation and research, and to develop a medical app community, and to remove developer roadblocks. And so the thinking basically here is that someone could build an app one time, and it could be used by different types of entities. It could be used by the patient control health record. It could be in a health information exchange, an EMR, and you just have to write the application once. You wouldn't have like 10 types of family histories in 10 different applications. You could really focus on making one good one. And of course, there would be many that would be created, and then the market would decide which is, the good one that, or maybe there's several types of ones that would be used in different settings. And so the keys to this project are basically developing a resource-oriented API, a data model. Important, of course, is authentication and a user interface. And so these are some of the apps that have currently already been developed and are in use and are available on, there's a gallery at smartplatforms.org that you can go to. My focus has essentially been just one of these, the Genomics Advisor, and in getting genomics information into this. But I'll talk about one or two of these as well as we go along here. So some of you may ask, there's a number of electronic health record vendors out there, and what if we can't interface with their system? One thing that can be done is a number of the systems are able to export, and essentially it's like a backup of their data into a data warehouse. And in such cases, essentially the SMART is built such that it could be on top of that I2B2. The I2B2 and data warehouse model was actually built by the same group that is now working on SMART, so there's been, it's a very easy connection there. So Smart App will just work on top of I2B2, which is a data warehouse that's being used across the world, actually. And as I mentioned, I'd be talking about an example of an app in terms of how it was actually implemented and used in an EMR. In this case, the Boston Children's Hospital EMR, where the Cerner was actually the vendor on that one. And so it really didn't, they looked at, what kind of app would be needed to build. So they looked at the list of apps, of things that are missing, functionality that was really missing and important by the IT department. And one of them, it turns out, was that for children, you have to kind of adjust the blood pressure measurements to know if it's really in the high or normal range. And so there was an app that was developed to just do this simple kind of translation. And that app, just didn't take very long to code. But the interesting thing is that once the developers developed the app, that's it. They weren't really needed anymore at all. Like their app, as it was written, could be integrated into the electronic medical record system. They didn't have to interact anymore. All that was needed was then to integrate it in as a module, and then that module could just work because it was part of the SMART system there. And now it's in full use at the Children's Hospital, just available in the system there. We anticipate, if people are doing, further apps, development cycle will probably be even faster because that was one of the first apps there. So in terms of looking at the Smart Genomics API, one of the goals that I had was to enable integration of genomic data from different sources. Maybe you have some data that comes from a particular vendor, some is from the cloud, some is from a lab result. Maybe the patient has some of their own data from 23andMe. How could you integrate different types of data? How could you enable the integration of the clinical and genomic data? And how could we have reusability so that the developer doesn't have to write the same code for different types of vendor applications? And finally, as a researcher, it would be good to have this as a way to promote the use of genetic data for research as well. So this is kind of a quick schematic of what this overall looks like. So we have the clinical API and the genomic API, which links, basically, it allows the EMR app, which can be, sitting on a PC, it can be on an iPad, there's iOS versions or, on a different device. And that app then can interact with the smart container, which basically is like the translator between the vendor-specific electronic medical record and then our app, or rather our smart API. And the same thing can happen with these different other entities. So let's say, for example, one that we have is like 23andMe would be a data source, and then there's a translation that allows it so that we can get that information directly, so that a person can just write a code one time and access any type of vendor's information rather than specifically having to write it for each one. And then, some of the benefits are that you don't have to really duplicate data. So let's say you have two different containers, two different sources of data. And really, the patient that you're looking for, they'll have, let's say, 4 records. An example might be, let's say that they have their own genetic sequence. Maybe there's some TB sequence that's being looked at, which was really done in an external lab. And so that basically, through the use of pointers, it can automatically update and get that from the other container through the Smart API, and it allows you to do that, so that you don't have to store that here separately, and then if this gets updated, then you would be using the wrong data. So this helps eliminate problems like that. Right now, we're working also with a number of people who actually are in this room on HL7 type standards. So there's both kind of traditional HL7 standards, as well as one of these called Fast Healthcare Interoperability Resources. And this standard has been presented so far to the governing board for potential adoption. And so what the thinking here is that it allows two things. It allows both the simple FHIR-like resources, but at the same time, it's going to also work with traditional document types of architectures, such as consolidated clinical document architecture. So the way we kind of view this is that you can both do things on kind of what you might do on a smartphone, which is almost like kind of like an email, quick exchanges of information. But then on the other hand, if you have a final report, kind of like a Word document or a PDF document, you can ship that through kind of a traditional and very structured format, like a CCDA, which is under Meaningful Use 2.0. And you guys can feel free to check out the standard at smartgenomics.wikispaces.com for more. It's all the standard is open source and so forth. So now I want to show you kind of an example of how this can be used and how we have been using it, and then kind of end with an app and one that you can check out. So you may have seen some of these before in the pictures that I had. These are some of the different applications that we have, and that many of them use the Smart Clinical API, but some of them, like the Genomics Advisor, can use the Genomics platform, and also the Diabetes Monograph can use the Genomics Advisor as a module. So basically, each of these can be their own program, but they can also be a module inside another program. So let's say you don't know much about, you don't really want to focus so much about the genomics, but you can use a genomics module that then would just kind of give you a little piece of information about the genomics that you could decide to potentially integrate in the future. And you wouldn't have to write the genomics module. You could just use the existing one, and then it would be just appear as a part of your app, kind of like how widgets might appear in a Windows system on your desktop. I'll show you an example of that, actually. So actually, this is an example of the Diabetes Monograph app, which is actually based on an app, or it is based on a view that was in a partner's computer system, which was called the Diabetes Monograph. And it did not have any of this genomic information, but because this integrates the genomic module, Genomic Advisor module, then these interface elements appear. And basically, they can interact with the other elements as well. So there's some semantic information. For example, you may want to know if you have a certain gene or you're going to have a certain drug interaction, and you have your medication list here, so you can do interactions. Or you can just visually display the information. If you hover, you can get information about your risk. In this case, it's focused on diabetes, so it's looking at diabetes type 1, 2, hypertension and cardiovascular disease, and risks for that, as well as some information about drugs. And then, that's what the physician may be interested in, but for some, if they want more detail, then you can actually look at the actual SNPs and look at the radar plot to see how much each SNP, each base in the genetic sequence is contributing to the risk. Finally, we found a lot of interest from all over the world. This, if you can't read this, it's because it's in Chinese. So this is actually the Chinese version. A number of people, since it's open source, a number of different groups have been interested in using the system, and we're really interested actually to work with China. They have a number of places where they've really centralized records, and about 4 times the population also of the United States, and rather homogeneous, about 98% Han. So some of the genetic variability issues that we may have here in terms of to look at for may be mitigated. So I'm gonna end, I guess, by showing you one of the apps that kind of takes advantage of all of these items. An app that, if you guys, and that's kind of, I think, one of the powers of these kind of apps that we have. It's like any one of you, if you have, an iOS kind of device, like an iPad, or an iPad Mini, can actually download right now. It's on the iTunes Store. It took a while to get through the review process, but it's up there. And it's basically, we believe it's the first program that integrates both genomic information, device information, which I'll talk about in a minute, EMR information, personal health record information, as well as it's the first one that allows you to sort of have this view, which integrates both the patient's perspective, the caregiver's perspective, and the physician's perspective in a unified view that includes all of these different entities, including devices. Like we'll see there's going to be a toy bear and the glucose meter. And it'll also be a mobile app that integrates not just kind of the clinical information that's actually from a record, but also genomic sequence information for that actual patient. So, let's say this is kind of the iTunes Store view. So if you click open, first you'd install it, then you click open. And then you basically, let me see here. Okay. Then you would basically, you can see the app and the reviews and all that, and then you'd install it, and then you'd have the app. And then when you run the app, you would see that you have a choice to get different pieces of information. There's a little bit of, in terms of family history. In this case, there's some diabetes, I think, somewhere up here, renal diabetes. And you can also get this information, which is essentially connected to a glucose meter. So what happens is that this system works with this toy bear that's made actually by a company that inside it has an Android device. And so it can upload to the cloud any information that is gathered. And we put a glucose meter in the backpack. So basically in the backpack of the bear. And so someone can actually take their glucose measurement and then that gets uploaded to the cloud, and that's what these measurements are over here. The min, average, and max per day that was measured by the glucose meter. So we like to think about this as our vampire bear because it likes to eat the blood of children. But once we get the measurements of the blood, then we have that here, and this is kind of useful for the parents to kind of, the helicopter parents who want to really know what their children are up to. They can see that right now, in their iPad today. They don't have to go in and get the clinical information that their doctor can log in and see with them in a visit. And this integrates real patient information. In this case, this particular one is using 23andMe information, but it could use other information through the Smart Genomics API. Again, looking at risk for different factors related to diabetes. And then the bear is kind of like an avatar. Have any of you seen Avatar? A lot of people seen Avatar. Yeah, I'm getting nods. So, okay. So I'm getting yes on the Avatar. So basically, in Avatar, what we're going to see here is that this bear will have emotions based on what the other bear is thinking. The other bear being the toy bear. So the goal is to engage the child when they're actually there with the doctor on a patient visit. And this is basically an example of one of those, as I mentioned, long tail apps. Like for those patients who this applies to, it's going to be very useful and they may use it a lot. But for most people, I mean, they're not going to use it. And why would a vendor make an app like this? Because it's not, there's no market specifically for it. But developers, because it's so easy to make, we've worked with undergrads to make most of the components in this app, can do it. And rather quickly. So basically, I don't know, you may be able to see the bears right now, rather happy. The glucose is in a good range, but the bear can be sad. The bear can have, you can see different levels of sadness and so forth. It's actually an animation. If you, I don't know if you guys have the video there and can zoom on it, but or you can come to me afterwards. But it's actually the bear is moving and has like emotional states. Rather than just a still picture, and you can kind of zoom in on the different categories and levels here, and different ways to view the genomic information and so forth as well. So, let's say one other thing about the bear. Yeah. So basically, the bear provides the kids a fun way to measure their glucose and insulin, and to take their insulin, and also. It kind of provides live data for the clinicians and patients. So the goal of this is basically to have one kind of a platform where, at a doctor's visit, everyone has something that they can see. There's feedback for all the people, the patient, the caregiver, which could be the parent, and the physician as well in terms of the clinical data. So they can make decisions together. And in that way, perhaps the child will be more likely to be involved and more engaged in their care. Not only when they're young and their parents are kind of monitoring them, but also beyond that when they're going to become more independent. And so it tries to engage the patients to increase their likelihood to comply with their diabetes treatment. So I think with that, I want to just acknowledge a number of people, just some of which are here from the SMART projects, certainly the Office of the National Coordinator, as well as a number of NIH grants that are supporting some of the fundamental research about some of the predictive models. Yeah.